Hey guys, a little PSA today. School's back in session, so this is probably the most common topic that I've been educating my patients on for the past 10 years. Dr. Derek here with Hagen Movement Institute. So someone comes in to see me for any physical trauma, injury, surgery, what have you, and I'll ask them what they've been doing so far to help. And more often than not, one of the techniques they tell me they've been implementing is icing the area to decrease swelling and inflammation. Now I'm going to run through real quick a few ideas that will show you, one, why we've been told to ice for decades, B, what ice does physiologically to our bodies, 3, why we don't want to decrease swelling and inflammation, and then D, what we want to do instead to help our bodies recover and heal. Whether you're a clinician trying to give sound treatment advice or you're a person trying to help recover your tissues more efficiently, I hope you can take a few points out of this whole thing. We've been told for decades to ice an injured or traumatized body part. One major reason for this is in 1978, Dr. Gabe Mirkin coined the term RICE, standing for rest, ice, compression, and elevation, in one of his sports medicine books. This term was widely used as the gold standard protocol for treatment of an injured body part. But then it was even used as a treatment for any bodily recovery process. Fast forward almost 40 years, and Dr. Mirkin has publicly recanted his RICE protocol, stating it's not the preferred treatment and not the preferred treatment for an acute athletic injury. He recanted based on current evidence. He even wrote the foreword for a book by the anti-ice man himself, Gary Reinl, in 2013. To me, it's pretty powerful if the doctor who coined the term RICE is telling us to stop icing, right? Now, we know ice is a vasoconstrictor, meaning it decreases the size and diameter of our blood vessels, which, as you may guess, slows down the blood flow. This has been said to decrease swelling and inflammation, but this brings me to my next point. Swelling and inflammation are two different things. Inflammation is the body's natural response to injury in an attempt to get cells needed to repair and remodel the tissue to the damaged site. We want those cells at the damaged site. If we decrease the size of our blood vessels, we're decreasing the efficiency of our body's natural healing processes, right? We're slowing down the healing process. Swelling is simply the accumulation of waste at the end of the inflammatory cycle. Our body has a highway of vessels and organs whose job is to rid the body of the waste and unwanted materials called the lymphatic system. And this brings me to my last point for now. What can we do to rid the body of the swelling that accumulates? What we can do is help the healing process. So what can we do to rebuild the damaged tissues? I'll give you a hint, and it's right in here, right? We can move. By activating muscles around the injured site, we are assisting in the passive lymphatic drainage system of the fluid. In other words, we're decreasing the congestion at the site by squeezing these lymphatic tissues with the contraction of surrounding musculature. If you find yourself in a situation where the question of ice comes up as a treatment option, you want to ask yourself, what are you trying to do? If your answer is to prevent further damage, would increasing fluid and congestion, would shutting off signals that alert you to harmful movement, and would slowing the process of getting the healing cells to the area be the right thing to do? Again, ask yourself, what are you trying to do? If your answer is regenerate damaged tissue, would slowing down angiogenesis, which is the process that forms new blood vessels in and around the area, be the right thing to do? I would say not. So to sum up, what does ice do? It traps waste in and around the damaged site and prevents the natural flow of oxygen and the supplies. It slows down your body's ability to heal normally. Movement is the easiest way to help your body recover. So as I always say, let's keep moving.